day. Allow me to introduce myself. I am Chene Baquero, a student nurse from Biliran Province State University, and I am here to discuss all about hypertension. So we have a PowerPoint presentation and a flyer for you to be able to understand more about the topic. So I was assigned to discuss the three objectives, define what is hypertension, risk factors for hypertension, and common symptoms of hypertension. First, let's discuss what is hypertension. Blood pressure is the force exerted by circulating blood against the walls of the body's arteries, the major blood vessels in the body. Hypertension is when blood pressure is too high. It is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. So let's go on to risk factors for hypertension. So there are two types of risk factors for hypertension: the modifiable risk factors and non-modifiable risk factors. The modifiable risk factors include lack of physical activity, unhealthy diet, being overweight or obese, drinking too much alcohol, sleep apnea, smoking and tobacco use, and stress. So first is lack of physical activity. It is not getting enough physical activity as part of your lifestyle increases your risk of getting high blood pressure. Physical activity is great for your heart and circulatory system in general, and blood pressure is no exception. So the second one is unhealthy diet. Good nutrition from a variety of sources is critical for your health. A diet that is too high in salt consumption as well as calories, saturated and trans fat, and sugar carries an additional risk of high blood pressure. On the other hand, making healthy food choices can actually help lower blood pressure. And the third one is being overweight or obese. Carrying too much weight puts an extra strain on your heart and circulatory system that can cause serious health problems. It also increases your risk of cardiovascular disease, diabetes, and high blood pressure. The fourth one is drinking too much alcohol. Drinking too much alcohol or regular heavy use of alcohol can cause many health problems, including heart failure, stroke, and irregular heartbeat. It can cause your blood pressure to increase dramatically and can also increase your risk of cancer, obesity, alcoholism, suicide, and accident. And the fifth one is sleep apnea. Sleep apnea may increase risk of developing HBP and is common in people with resistant hypertension. And the sixth one is smoking and tobacco use. Using tobacco can cause your blood pressure to temporarily increase and can contribute to damaged arteries. Secondhand smoke, exposure to other people's smoke, also increases the risk of heart disease for non-smokers. And the last one for modifiable risk is stress. Stress is not necessarily a bad thing in and of itself, but too much stress may contribute to increased blood pressure. Also, too much stress can encourage behaviors that increase blood pressure, such as poor diet, physical inactivity, and using tobacco or drinking alcohol more than usual. So let's go on to non-modifiable risk factors. Non-modifiable risk factors include a family history of hypertension, age over 65 years, and coexisting disease such as diabetes or kidney disease. So the first one for non-modifiable disease is family history of hypertension. If your parents or other close blood relatives have high blood pressure, So there's an increased chance that you'll get it too. So the second one is age over 65 years. The older you are, the more likely you are to get high blood pressure. As we age, our blood vessels gradually lose some of elastic quality, which can contribute to increased blood pressure. And the third one is gender. Until age 64, men are more likely to get high blood pressure than women are. At 65 and older, women are likely to get high blood pressure. And the last one is chronic kidney disease. HBP may occur as a result of kidney disease, and having HBP may also cause further kidney damage. So let's go to the third objectives, the sign and symptoms of hypertension. The first one symptoms is recurrent headaches. Headaches are fairly common among people with or without hypertension. Some people with hypertension notice changes or worsening of headaches when medication are skipped or when the blood pressure becomes higher than usual. Headaches associated with hypertension can be mild, moderate, or severe and can be a throbbing nature. So the second one is dizziness. People with hypertension may notice dizziness in relation to medication doses and blood pressure fluctuations. So the third one is shortness of breath. The shortness of breath, hypertension can cause shortness of breath as a result of the effect on the heart and lung function. So here are also rare symptoms of hypertension. Blurry vision or other vision disturbances. Blurred visions and vision changes are warning signs that you could be at the risk of a serious health problem such as stroke or heart attack. And the second one is headaches, dizziness, and nausea. The last one is nausea, vomiting or loss of appetite. Nausea associated with severe hypertension can develop suddenly and may be associated with dizziness. So, thank you for listening, Mom. That's all, and I hope that you learned for this discussion. Thank you.
Sir, my name is Arnulfo R from Biliran Province State University in the section of BSN-1D. I'm here to discuss about hypertension. These are the infographics that will tell you some of the information about hypertension. The first objective is the best way to detect hypertension. The best way to detect hypertension is by using a blood pressure test. Blood pressure test measures the pressure in your arteries as your heart pumps. You might have a pressure test as a part of a doctor's appointment or as a screening for high blood pressure or hypertension. Some people use a blood pressure test at home to better track this. The next objective is the complications of uncontrolled hypertension. Heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, which can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart pumping chamber to thicken. Eventually, the thickened muscle may have a hard time pumping enough blood to meet your body's needs, which can lead to heart failure. Weakened and narrow blood vessels in your kidneys. This can prevent these organs from functioning normally. Thickened, narrowed, or torn blood vessels in the eyes. This can result in vision loss. Metabolic syndrome. This syndrome is a group of disorders of your body metabolism, including increased waist size, high triglycerides, decreased high density lipoprotein, cholesterol, high high blood pressure, and high insulin levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Troubles with memories or understanding. Uncontrolled high blood pressure may also affect your ability to think, remember, and learn. Trouble with memory or understanding concept is more common in people with high blood pressure. Dementia. Narrow or blocked arteries can be limit flow to a certain type of dementia. A stroke that interrupts blood flow to the brain to also can cause vascular dementia. That's all, and I hope you learn about the topic of our group topic, hypertension.
Good day, ma'am. Good evening. I am Rhea A Atok, a student nurse from Biliran Province State University. I am here to discuss the two objectives that was assigned to me. The first objective is how can the burden of hypertension be reduced, and the second objective is understanding the blood pressure readings. So I have here a PowerPoint presentation and infographics for you to know more about the two topics that I'll be discussing later on. So the first objective that I'll be discussing is the how can the burden of hypertension be reduced. So hypertension is a major cause of premature death worldwide. So most people with high blood pressure didn't know they have it. So 1 in 4 men have hypertension and 1 in 5 women have hypertension. So to reduce hypertension, mom, we should first reduce salt intake to less than 5 grams daily. Then second one is to eat fruits and vegetables regularly. Third is to avoid saturated fats like cakes, biscuits, cheese, chorizo, sausage, and bacon, and other saturated fats, mom. Then avoid trans fats like french fries, frozen pizza, non-dairy coffee creamer, donuts, fried chicken, and other trans fats foods. Then the fourth one is to avoid smoking, avoid tobacco. Fifth one is to reduce alcohol. And lastly, be physically active every day. The second objective, understanding blood pressure readings. So, the first step to managing blood pressure is to understand the mean, what the levels mean, and what is considered normal, elevated, high blood pressure, or hypertension, and hypertensive crisis. So blood pressure is typically recorded as two numbers, like 117, read as 117 over 76 millimeters of mercury. So 117, the top number, 117, the top number, the higher of the two numbers measures the pressure in the arteries when the heart beats, when the heart muscle contracts. Then diastolic, here the bottom number, diastolic, the bottom number. The lower of the two numbers measures the pressure in the arteries when the heart is resting between heartbeats. Then, blood pressure category. If normal, the systolic is lower than 120 and the diastolic is lower than 80. Then elevated blood pressure, systolic is 120 to 129 and diastolic is 80. High blood pressure or the hypertension stage 1, the systolic is 130 to 139 and the diastolic is 80 over 89. Next is the high blood pressure hypertension stage 2. 140 is the systolic or higher, then the diastolic is 90 higher. Then the last one is hypertensive crisis. This is if the crisis, you should consult your doctor immediately. So the systolic is higher than 180 and the diastolic is higher than 120. So healthcare providers can take blood pressure readings and provide recommendations. Check, change, control helps you track your progress in reducing blood pressure. So tips for success: eat smart, move more, manage weight, don't smoke, and lastly, sleep well. So the first one is eat smart. Eat a healthy diet: vegetables, fruits, whole grains, beans, nuts, plant-based proteins, lean animal proteins, and fish. Then you should limit the sodium, saturated fats, and added sugars. Limit sugary foods and drinks, fatty or processed meats, salty foods, refined carbohydrates, and highly processed foods. Next is to move more. Physical activity helps control blood pressure, weight, and stress levels. Third one is to manage weight. If you are overweight, even a slight weight loss can reduce high blood pressure. The fourth one is do not smoke. Every time you smoke, vape, or use tobacco, the nicotine can cause a temporary increase in blood pressure. So avoid smoking. Then lastly is to sleep well. Short sleep, less than 6 hours, and poor quality sleep are associated with high blood pressure. So that's all, ma'am. Thank you for listening. I hope na you have learned what I have discussed. Thank you.
Ma'am.
Thank you for your cooperation, ma'am.
Thank you.
So, we're done with the discussion. Now, I will demonstrate to you as well as your significant other how to take blood pressure using a manual blood pressure monitor here. And also, the most easiest one, the automatic blood pressure monitor. So, I will demonstrate first using the manual blood pressure monitor. Okay, first we will locate the location of the pulse. So normally we will find it here. So once you locate the location of the pulse, we will now insert the cuff Okay, not too tight and not too... So all we just need to do is to inflate and deflate the cup. Then it's done. But to monitor your daily blood pressure, you need a notebook and a pen to write it down. Next, we will use the automatic blood pressure. So as you can see the result here, we have 126 over 89. The systolic is 126. Just a little bit higher than normal. And the diastolic is 89. And you can also see the pulse. So I think the best way to monitor your blood pressure is at home is to use an automatic blood pressure monitor. But if you can manage to use a manual blood pressure monitor, it is more better. So we're done with the demonstration. Do you have any clarifications and concerns, ma'am?
Magsaon man pag monitor nga. Ito ang blood pressure.
Okay. First, you need, of course, a blood pressure monitor. It could be electronic or the automatic blood pressure monitor, and it is much better if you have a manual blood pressure monitor at home. Then, to monitor it, you need a notebook and a pen, and you need to write it down, the findings every time you take the blood pressure of your father. Of course, to monitor your blood pressure correctly, every day, you need to take the blood pressure of your father at a constant time. If you started at monitoring at 9 a.m., you should start also the next morning at 9 a.m. Then, last note is to make sure that your father must not eating anything 30 minutes before you take his blood pressure. So, do you have any clarifications and concerns pa? No? Okay, so I think it's the end of our discussion. Thank you.